Reflux is often a mechanical problem, not just too much acid. A lot of people actually think that their stomach produces too much acid, and so that's why they have reflux or why they have heartburn. But the problem is actually the barrier between the stomach and the esophagus. But the diaphragm is a muscle that basically is the barrier between your abdomen cavity and your chest cavity. So everything above the diaphragm is in your chest. It's like your heart, your lungs, your esophagus is there. And then everything below the diaphragm is your abdomen. That's where your intestines and your stomach are. And so right at the area between where the stomach and the esophagus meet, there is a higher pressure area that creates kind of like a little flat valve. And that's sometimes called the lower esophageal sphincter. The lower esophageal sphincter is there to create a little bit increased pressure so that once something passes down the esophagus and into the stomach, it doesn't want to go backwards because that pressure barrier is going to keep it there. Now, our anatomy, if it's completely normal, you should have esophagus in your chest above the diaphragm, and then there's an opening in the diaphragm that's called a hiatus that the esophagus passes through, and the junction between your esophagus and your stomach should live just below the diaphragm, actually in your abdomen. So I often tell my patients that when everything's in the right place, meaning that the lower esophageal sphincter is below the diaphragm, the lower esophageal sphincter is living in a positive environment, positive pressure. So your stomach, you can squeeze your muscles, you can hold your breath, you can push, and that positive pressure actually helps to push the lower esophageal sphincter more closed. There is a problem called a hiatal hernia, which is where the top part of the stomach and the lower esophageal sphincter actually goes up through that opening in the diaphragm, and now it lives in the chest. And so I always tell patients that if your lower esophageal sphincter is living in a negative pressure environment, and again, our chest is negative pressure, so like that's why you can suck air into your lungs because there's negative pressure inside your chest. Well, if that lower esophageal sphincter lives in the chest, that negative pressure wants to open the lower esophageal sphincter and then actually draw the acid up. So just like you can suck air into your lungs, like you can also suck acid out of your stomach, so to speak, and kind of go up into your lower esophagus. And that leads to the reflux. So if the valve mechanism becomes weak, or if a part of the stomach slides upward into the diaphragm, you can develop reflux symptoms that medications alone aren't going to help you.